In this video, we will discuss various classification schemes of infectious diseases and explore some basic concepts in epidemiology. Infectious diseases can be classified in a number of ways, including the body system they affect, by taxonomic categories, the longevity and severity of the disease, the manner in which they are transmitted, and their effects on populations. In this section, we will focus on the terms presented in Table 1412 that are used to classify infectious diseases. Diseases may be classified based on the terms of the severity and duration of the disease. Terminology used to classify diseases based on this criteria include acute, chronic, and latent. An acute disease is a disease that develops rapidly but only lasts a short time, such as the common cold or the influenza. Chronic diseases, on the other hand, develop more slowly and may last for a prolonged period of time. Chronic infectious diseases are diseases like tuberculosis and hepatitis B. Diseases that lie between these two extremes are known as subacute. Latent diseases are those in which the causative agent may lie dormant for a period of time and then periodically become active to produce signs and symptoms. Latent diseases include diseases such as herpes and shingles. Asymptomatic diseases, on the other hand, do not present symptoms. Diseases may also be classified in such a way as to reflect the extent to which the host body is infected. Local infections are infections that remain confined to a particular anatomical region of the body. Examples include boils, fungal infections, and warts. Systemic infections, on the other hand, are infections that are widespread and involve many systems. Such infections are generally spread by the bloodstream or lymphatics. Examples of systemic infections include AIDS, chickenpox, and measles. Focal infections are infections that remain confined to a particular region of the body and serves as a source of pathogens that spread to other areas of the body. Examples of focal infections include tuberculosis and streptococcal pharyngitis, which causes scarlet fever. Diseases may be described based upon the sequence of the infection. A primary infection refers to the initial infection in the patient. Primary infections can weaken a host immunity, allowing opportunistic pathogens to also cause infections. Infections that follow the primary infection are known as secondary infections. Sometimes secondary infections are more dangerous than the primary infection. Streptococcal bronchopneumonia following an influenza infection is an example of a secondary infection that is more serious than the primary infection. Classification of infectious diseases may also be based on the manner in which the disease is transmitted in the population. Diseases referred to as communicable diseases are those that spread from one host to another, either directly or indirectly. Influenza, chickenpox, measles, and tuberculosis are some examples of communicable diseases. Contagious diseases are communicable diseases that are easily spread from one person to another. Influenza and measles are considered contagious communicable diseases. Non-communicable diseases do not spread from one host to another. Thus, the infected individual is not a source of infection to others. The causative agent of non-communicable diseases is one that typically resides on the body and only occasionally causes disease, or one that resides outside the body and only causes disease when introduced into the body. A prime example is tetanus caused by accidental exposure to Clostridium tetani. The majority of Chapter 14 has focused on the interaction between the pathogen and the individual. Diseases also impact the community. Epidemiology is the field of study that focuses on the manner in which pathogens affect populations. Epidemiology studies the frequency and distribution of diseases within the population. Epidemiologists utilize two measures to track diseases: incidence and prevalence. The incidence is the number of new cases of disease in a given area during a given period of time, whereas the prevalence is the total number of cases of disease in a given area during a given period of time. The incidence and prevalence are followed over a long period of time and can be useful in predicting trends. Monitoring such data makes it possible to define the frequency and geographic distribution of diseases as well. Four terms utilized to define frequency and geographic distribution of disease are endemic, sporadic, epidemic, and pandemic. Endemic diseases are those that exhibit a relatively steady frequency within a given geographic location over a long period of time. An example of an endemic disease is Lyme disease, which is a disease that is transmitted by a tick vector within the northeastern United States. Sporadic diseases are those that occur only occasionally at irregular intervals in random locations. Tetanus within the United States is considered a sporadic disease. Epidemics occur when an endemic or sporadic disease begins to increase beyond the normally expected numbers for a given area over a short period of time. Please do not assume that the number of individuals infected must reach into the thousands or more to be considered an epidemic. An excellent example provided by your book is the hantavirus epidemic that occurred in 1993 in the Four Corners area of the United States. Fewer than 200 cases were observed in the epidemic. However, the situation was deemed an epidemic because these were the first cases reported in the region. A pandemic disease is one in which an epidemic disease occurs on more than one continent. AIDS is deemed as a pandemic disease. The H1N1 flu or swine flu also became a pandemic in 2009. Infectious diseases acquired in a healthcare setting are known as nosocomial infections. This includes clinics, hospitals, dental offices, and nursing homes. Several factors contribute to the development of a nosocomial infection. One important factor is the presence of microbes in the healthcare setting. Healthcare settings serve as a reservoir of pathogens, even though precautions are taken to kill and inhibit the growth of microorganisms. Many of the potential pathogens are opportunistic pathogens, and many of the microorganisms present within the hospital are also resistant to the antimicrobial drugs utilized to treat infections. Another factor that contributes to infection is the weakened or compromised immune system of the individual. Individuals in the hospital setting are present because they are already diseased, which compromises their immune system, or they may be receiving some form of therapeutic treatment that compromises their immune system. Some patients will be more susceptible to contracting nosocomial infections. Patients with burns, open wounds, surgical sites, or who have had any form of invasive procedure performed that disrupt the protective barriers have an increased likelihood of contracting a nosocomial infection. In addition, patients undergoing procedures or drug treatments or that have a disease condition that depresses the immune system are also more likely to develop nosocomial infections. A third factor that influences the development of nosocomial infections is the chain of transmission in the hospital environment. Pathogens may be transmitted via direct contact from healthcare workers to the patient, from the patient to another patient, or from visitor to the patient. Pathogens may also be indirectly transmitted to the patient on fomites, including blood pressure cuffs, urinary catheters, needles, thermometers, stethoscopes, among many other items present in the hospital setting. There are three types of nosocomial infections that may develop. Those known as exogenous infections are those that are caused by pathogens acquired from the healthcare environment. Endogenous infections are those caused by the normal microbiota due to factors within the healthcare setting. Finally, iatrogenic nosocomial infections result from modern healthcare practices such as needles and catheters. A special type of infection known as a superinfection results from the use of antimicrobial drugs. Superinfections arise when an antimicrobial drug kills some microorganisms but allows others to thrive and cause infection due to the absence of microbial competition. We will discuss superinfections in more detail in Unit 4. The development of nosocomial infections can be reduced by employing a number of activities. Among those activities are proper hand washing, medical and surgical asepsis, utilization of special precautions, and good housekeeping.